Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here in this video we can see important and previous year questions for staff nurse exam preparation. Here we are preparing questions for RRB staff nurse exam, DSSSB, ESIC, DME, Kerala PSC exam, also insurance medical service exam, JPHN exam. Let's start the question. First question, patient is receiving continuous salbutamol nebulization therapy. What should a nurse assess for? Option A serum sodium, option B serum potassium, option C serum calcium, option D serum phosphorus. Here the question is, patient is receiving continuous salbutamol nebulization. Salbutamol is an example of bronchodilator. It is a short acting beta antagonist. Its main side effect is hypokalemia. So the nurse should check the serum potassium level. Okay, here correct answer will come option B, serum potassium, because the side effect of this salbutamol therapy is hypokalemia. And the next question, the patient is admitted to the emergency department having difficulty with respiratory, vasomotor and cardiac function. Which portion of the brain is affected to cause this manifestation? Options, option A medulla, option B cerebrum, option C cerebellum, option D pons. Here the question is, a patient admitted to the emergency department with difficulty in respiratory problem with vasomotor and cardiac function. Which part of the brain is affected? That is the question. So as we have to know, the location of cardiovascular center is medulla oblongata. Same location of respiratory center also medulla oblongata. So the answer will come medulla. Okay, medulla or medulla oblongata. Move on to the next question. Surfactant production start at the age of option A 20th weeks, option B 32 weeks, option C 28th weeks, option D 36th week. Surfactant production start at 28th week of gestation. Option C is the correct answer, between 24 to 28th week. That is the correct answer. And the next question, the hormone which helps in glycogenolysis is option A epinephrine, option B estrogen, option C trypsin, option D all of this. Question, which hormone helps in glycogenolysis? Glycogenolysis means glycogen breaks down into glucose. It is mainly occurs in liver with the help of epinephrine. Option A is the correct answer. And the next question, which of the following is not included in National Vector-Borne Disease Control Program? Options, option A dengue, option B malaria, option C filaria, option D plague. Mainly 6 diseases are prevented by this National Vector-Borne Disease Control Program. First one Kala-Azar, second one dengue, malaria, chikungunya, Japanese encephalitis and filariasis. So here in our option dengue, malaria, filaria is there, plague is not there. So that is the correct answer, option D. And the next question, apex of the heart is formed mostly by options, option A right atrium, option B right ventricles, option C left ventricles, option D left atrium. Apex of the heart is formed by left ventricles. It lies posteriorly to the left fifth intercostal space. Here answer option C left ventricles. The next question, during lumbar puncture, which position is given to a patient? Option A supine position, option B side lying or C-shaped position, option C lithotomy position, option D Fowler's position. Question, which position is given to a patient during lumbar puncture? Lumbar puncture or spinal tap or spinal puncture is the insertion of a needle into the lumbar region of the spine. The position given for this procedure is that the patient should be in fetal attitude or C-shaped position with full flexion of the spine. So here side lying or C-shaped position. Option B is the correct answer. The site for this procedure is in adult between 3rd and 4th lumbar vertebrae and in children between 4th and 5th lumbar vertebrae. And the next question, omitting of blood is called. Options: option A epistasis, option B hemoptysis, option C hematemesis, option D hemothorax. Blood vomiting is known as hematemesis. Option C is the correct answer. First option epistasis means bleeding from the nose. Second option hemoptysis means blood in the sputum. And fourth option hemothorax means collection of fluid in the pleural space. Here vomiting of blood is known as hematemesis. And the next question, a patient is getting IV fluids through peripheral cannula shows redness, cool, edema and decreased flow rate. The possible diagnosis is options: option A infiltration, option B phlebitis, option C allergic reaction, option D hypersensitivity. Here the question is, a patient is getting IV fluid through cannula and the cannulated area become a red, cool, edema and decreased flow rate. What is the possible diagnosis? That is the question. Here the correct answer will come option A, infiltration. Infiltration means is the escape of fluid into the subcutaneous tissue, mainly due to displacement of the needle. So the signs and symptoms include development of swelling, hardness, pain around the needle site, feeling of numbness, coolness around the injection site, failure of the fluid return into the tube, and decreased flow rate or the signs and symptoms of this infiltration. So we have to stop the IV fluid immediately. Here answer will come option A, infiltration. And the next question, compression of bleeding carotid artery immediately leads to options: option A vomiting, option B stroke, option C blindness, option D loss of sense of smell. So here the question is, compression of bleeding carotid artery immediately leads to stroke because the brain will not get adequate amount of blood. Due to that, there may be chance of thromboembolic reaction which may lead to stroke. Option B is the correct answer. And the next question, which of the following is the largest cranial nerve? Option A cranial nerve 6, option B cranial nerve 5, option C cranial nerve 10, option D cranial nerve 7. Largest cranial nerve is trigeminal nerve. Option B cranial nerve 5. 5 is trigeminal nerve. And the longest cranial nerve is vagus nerve, that is 10th cranial nerve. Largest cranial nerve is trigeminal, longest is vagus. And the next question and last question in the series, tarsals of the ankles are examples of which type of bone? Options: option A short bone, option B sesamoid bone, option C long bones, option D pneumatic bone. Tarsal bone is an example of short bone. Option A is the correct answer. So here we discussed important and previous year questions from the question papers. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. Thank you for watching my video. Keep on studying. Study according to the syllabus. All the very best.